Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much, and Jazakallah khair for inviting me for this talk. My name is Sayyid Rizwan Gillani, and I am a consulting GP in diabetes at New Cross Hospital, Wolverhampton. And I'm also a GP principal in a GP surgery. And today I will be talking to you about various topics around COVID-19 as well as diabetes and Ramadan and whatever else question we have to address. Thank you for providing me with this opportunity.
Jazakallah khair, Dr. Saab, for taking the time to talk to us. So what we'll do is we'll ask you a series of questions, inshallah. Okay. Starting out with, as you know, the topic that everybody in town is talking about, COVID-19. Okay.
Yeah.
So we believe that Ramadan is likely to start from the 13th of May, 2021. What do you think is the anticipated government policy of vaccination in the next 6 to 8 weeks? And in your opinion, I mean, we believe it's likely the vaccination is going to carry on during Ramadan. So what are your thoughts on that?
Yes, I think you're right. The vaccination program will continue because, as you might be aware, there are government set guidance about the vaccination targets. By 15th of April, they want everybody over the age of 50 and all those who are vulnerable. Adults aged over 16 needs to get at least one jab done by 15th of April, and then all adults should have at least one dose of vaccine by the end of July. So the program will continue, and the only limiting factor in the program could be the vaccination supply. And the other important thing is that there are people who received their first dose about 10 weeks ago, 11 weeks ago. They are due for their second doses now. So the program will continue throughout Ramadan.
Okay, inshallah. So Mufti Amjad has, as you know, on the YouTube channel has already addressed the point that those who are getting the injections during Ramadan, it has no impact on your fast, right? However, I mean, it could be that when people either have the first jab or the second jab, they could have the side effects of the vaccination, i.e., develop some symptoms. So what do you suggest? I mean, are there any extra precautions that Muslims need to take if they're fasting and they need to take the shot, either the first one or the second one?
I think the vaccination, whenever we take it, it has to produce a reaction to be effective in the body, and that reaction then comes up as symptoms, which are usually a sore arm, aches and pains, feeling under the weather, and can last up to 2 to 3 days. If you're fasting, obviously it can be challenging because you can't take paracetamol, which most people will need to take if they are experiencing those symptoms. However, every individual is different and they react differently to vaccine. For my own self, when I had the vaccine, I actually did not have any symptoms that require any treatment such as paracetamol. It was all bearable, mild aches and pains and bit of sore arm, nothing else. So I think it really depends if you are among the age group which are healthy otherwise, and you are, mashallah, strong enough to bear those aches and pains, then you can continue with your fast as it is. But if you are one of those individuals where symptoms are more than usual and you need to take some medicine, then I think you need to take the medicine, and it comes under category that you are unwell.
Okay. And is it recommended if you think that you're going to be affected by the reaction to actually take paracetamol maybe around Sahri time or something, even if your appointment may be during the day?
You could. I think most symptoms actually start within 24 hours after you have the vaccine.
Okay.
I would not expect people to have the vaccine and straight away start having symptoms. So it is quite possible that if you want to book your appointments in the afternoon so that it can be near the Iftaar time, and if then you have enough times up till Sahri, that if you need to take paracetamol, you can take paracetamol.
Okay. Jazakallah khair. So, as you know, mine and your local mosque, I had a conversation with the Imam Sahib today, and every year they used to have people opening the fast at the masjid collectively, and some people even doing sehri. So the masjid has cancelled that for this year, right? Because of obviously safety precautions. So what are your thoughts on that? Because some mosques I'm hearing that they've cancelled the iftari and sehri, and some want to do that. So is it a possibility? First of all, what do you recommend? And Is it something that they can carry on safely, and what precautions should they take if they choose to do that?
I'm sure that people are aware of there are talks about third wave, especially in Europe, and certain countries have gone into lockdown. Turkey has seen the highest numbers for the first time in this pandemic, which got infected with COVID-19. So we are still not out of woods. Pandemic is still there, and we must follow the government guidelines about meeting, especially indoor meetings. And I can see that all the community spirit of Ramadan, and we experienced it ourselves, and how it brings us together and keep us motivated and bring all the joys of Ramadan, which is totally understandable. But I think we are still in the middle of pandemic, and we should try to minimize communal activities so that we should not hit the third wave. So my professional advice is that if those those things which are not compulsory for us to have a communal gatherings, we should avoid them. And I think our mosque has taken the right decision in this regard.
Okay. Jazakallah. When it comes to Tarawih, obviously, I'm going to the masjid such as you are, and people are doing just their fard salah and exiting, just a few minutes stay indoors and exiting. But when it comes to Ramadan, obviously we're going to have Tarawih, which takes a longer period of time. So we've received these questions, and mosques are asking, this is the first time that, last year because of COVID-19, the masjid wasn't open.
Yeah.
This year it is going to be open, and people are going to be indoors for prolonged period, a little bit longer period of time for Tarawih, right? So the mosques are asking, are there any extra precautions they need to take for that?
I think the first thing is that I would encourage all our community members where the vaccination uptake is low to get vaccinated, at least have one jab before Ramadan. It usually takes between 10 to 14 days to become effective as well, which gives at least some sort of protection against severe disease, which is a basic issue here. If somebody get infected with COVID-19 and they stay at home and they get better, that doesn't matter. But when they become so unwell that they need to get to the hospital or need an ITU bed, then there is serious concerns around that. Whenever there will be an indoor gathering over such a long period of time, because it will easily take an hour, if not more, for most people to be in there,
For Tarawih.
then for the Tarawih, then I think it is going to be a higher risk. The question about what extra precautions, I think just following the guidance, because I'm sure you and me both have seen that sometimes we lax in following the guidance uh, as far as mask wearing is concerned, as far as bringing your own prayer mat is concerned. Uh, I have seen a pattern of relaxation over last few weeks, even in the Jummah prayer.
In the Jummah prayers,
And especially then people wear the mask but have their nose outside the mask. That does just kill the purpose straight away.
Yeah.
I think it's just a matter of how strictly you can adhere to those guidance. Again, keeping the area well ventilated is the key. And I have also heard that when the windows were open, people were questioning that it is so cold outside, why we are keeping the windows open. Perhaps it is a lack of understanding why it is important to keep area very well ventilated. And then we initially had some temperature checks, etc., to enter the building that are gone as well. I think there would be quite strict guidance to those measures which are supposed to be there on the first instance would help. And maybe mosque has to think outside the box to think whether there is any way they can try to separate the two prayers, or make it in a way that people can still have Tarawih but in a lesser crowd.
So we can have maybe multiple jamaats, like what we're doing for Jummah. So instead of one, we're having 3 jamaats or something. So we should. So you think we can probably, the mosques should look into that? Maybe
This is one of the options, but I can understand it is a very sort of long time, and whether we can do it. We know that we have done two jamaats for last couple of years. One which was rather quick one, and another which was the usual one. Perhaps again we need to think about whether this is the possibility and we can still hold Tarawih but in a slightly different way, which can allow people to attend, but in different groups.
Okay. When it comes to Eid Salah, as you know, it's encouraged to actually do Eid Salah outdoors, like in an Eidgah and stuff, instead of the masjid, right? So, what is your professional opinion about this? So, when it comes to, when we're over Ramadan, inshallah, approaching Eid, I mean, should we approach it because it's kind of encouraged in Islam to do it outdoors or in a park or a field or a big community hall anyway?
Yes, I think Eid is perhaps coming around 13th of May. We still have
June,
quite a few weeks to go.
yeah, May,
And
sorry,
there
yeah.
will be some sort of changes happening either in COVID, which we hope and wish that they are all towards the positive direction. If the infection rates are low, if the people have got vaccinated at least with the first dose, then we should be looking at how we can celebrate Eid. And we have tried that outdoor once before. Trying outdoor is much safer under given circumstances. I think the regulations will be a gathering of about 30 people, but if we can then have a Eid namaz, maybe 2 or 3 Eid namaz. But most important thing is people should respect social distance, and we have a tradition that we hug each other after the Eid namaz. I think we need to be quite careful when it comes to those things. Prayer is one thing, doing the other cultural bits is another thing. So we still need to respect the social distancing measures, and especially we should be looking after our elderly uh, because that is the time when they are at highest risk.
Okay. Jazakallah. One question is, I mean, you've been to the masjid during iftar time and the kind of diet that people have of iftar, oily food, pakoras and samosas and stuff, right? So from a health perspective, what are the best types of food that people should consume during Ramadan? That is both at iftar time when opening the fast and also at suhoor time when they're getting ready to fast.
So this is the very, very common question which everybody asks. And I'm still surprised that in this day and age, people need to know about what are the good type of foods and what are not so good. Uh, I think everybody in their heart actually knows what are the type of food they should be eating. But if you want me to elaborate further, we all know that the fried food is never good, let alone in Ramadan. It is never good for health. So all the samosas and pakoras, which are basically the cultural traditions for South Asian community, uh, these are all things which, unfortunately or fortunately, they taste nice. I think every food which is bad tastes nice.
Yeah.
So I can understand people's indulgence in having those foods. My advice is that the human behavior is if we try to stop something strictly, the people try to do it uh, or more eager to
More
do it.
inclined
So
to do it.
more inclined to do it. So best is that have some of those, but have it in moderation. We know they are not good for health. If you want to have one pakoda or one samosa and not have a loads of them, because they will not only stuff your stomach, they will cause indigestion. They will also be bad for your cholesterol, heart diseases, diabetes, you name it. So eat it in moderation if you need to eat. But if you ask me what are the better foods to have, I think complex carbohydrates such as rice, wholemeal, chapatis, uh, lentils. These are the food which are good to digest slowly so that they can release blood sugar in a more sustained way rather than producing big spikes of glucose. Again, in we have a tradition or a culture that they, there are some milkshakes or there are what they call roux afza type of
Sugary drinks.
sugary drinks which we use to break fast. Again, a very quick releasing carbohydrates which will produce a surge in the body for glucose, which will go very high very quickly. And when you mix them with dates, which are again quite a high glycemic index food, produce a sugar surge in the body, then that means that body might struggle to cope with that kind of surge. So again, if you're asking what is the best thing, perhaps water is the best thing. Uh, but if you do need to drink those sugary drinks, then use smaller amounts rather than large, big glasses.
Large portions. Okay. Jazakallah. Okay. Many people are asking, who are diabetics, and asking for any specific advice, during the month of Ramadan, and what should they discuss with their GP and what precautions they should take.
Diabetes is actually a very broad field, and the good thing about diabetes is that it is very unique to individuals. Quite a lot of our community people will have diabetes, but their diabetes is in early stages or controlled by the type of medications with very little risk of producing low blood sugar or hypoglycemia. And these are the individuals who perhaps can still keep fast without any added risk of developing low blood sugars. However, their medication dose might needs adjusting. But there are other people with diabetes who are on certain tablets or especially insulin injections, where there is a very high risk to develop hypoglycemia with a prolonged period of fasts. And these are the people who are at real risk by keeping especially the longer fasts, which are the summer months in Britain. So it is very important that A, they understand what type of diabetes they have. Number two, what type of complications of diabetes they already have, and whether they have got awareness of hypoglycemia. Again, there are various types of insulins which act very differently. Some of them are just once a day, some of them are twice a day, and some of them might require 4 injections a day. Those who have got type 1 diabetes or they require 4 injections of insulin a day, they must not fast. Their risk of developing hypoglycemia is way too high to accommodate in any advice. So these are the people who perhaps should speak with ulama karam and go for other options such as fidya to sort of pay for their fasting, but
Missed
they,
fasts.
missed fast, and they must not fast. Those who are on twice a day injection or once a day injection, again, speak with your doctor, because there is possibility of dose adjustment, possibility of time adjustment, which will still allow you to fast. Again, the most important message is if you develop symptoms of hypoglycemia can be life threatening.
Yeah.
And we should not actually even try to see how the hypoglycemia is going to progress, because once it is there, it is only going to get worse. So break your fast, eat something, treat your hypoglycemia.
Absolutely. Right. The same kind of applies to asthma. So basically, the patients who have the blue inhaler, which they have to take, right? That you have to take. And even, some of the scholars, they say if the fast breaks, right? The fast breaks, there's no penalty on that. Because it's a life-threatening. You have to take your blue inhaler. But what about the brown inhaler or other preventative medication during Ramadan, right? Is there any dosage adjustments that they can talk to the doctor about?
So first thing is that the basic understanding is that the blue inhaler is only to be used when needed. If you need to use blue inhaler regularly, that simply means that your preventative therapy is inadequate.
Okay.
The blue inhaler, what we call is reliever, which is basically used to relieve once the symptoms have already come to you. But the brown inhalers, as you mentioned, and now there are so many types of inhalers. There are purple ones, there are red ones. These are the inhalers which we call preventers, which are there to prevent the asthma to happen, so that you don't need to use blue inhalers.
Okay.
The British Thoracic Society guidance is that if you need to use blue inhaler more than twice a week, you should be seeking advice from your doctor so that your preventative treatment can be updated.
Okay.
So first thing is that if you're using blue inhaler on regular basis, there is need of optimization of your treatment of asthma. The second thing is that now there are lots of inhalers which are very long acting inhalers, and sometimes you only need to use them once, maximum twice a day. And their dose can be adjusted even between iftar and sahur. There is enough time for those to be used twice a day. and the doses can be adjusted accordingly.
Okay.
So for all my brothers and sisters who suffer with asthma, if you are using blue inhalers, speak with your doctor. If you are using long-acting inhalers, you are already on once or twice a day inhaler, which can still be used with during the period of Ramadan.
Okay.
However, the message is again, if you start having signs and symptoms of asthma, your chest is getting tight, you are becoming wheezier, you have got any difficulty in breathing or shortness of breath, then you should not wait. You should just go and use your blue inhaler and then seek further help as needed.
Okay. Jazakallah khairan. So it's an important message here for those with diabetes and asthma that they have to, if they have to take these kind of medications, then your fast breaks, but there's no penalty on this person. Okay, it's important for people to understand that they don't have to fast for 60 days or something like that. What about women who are pregnant, right? Is there any guidance around fasting? I mean, if they're into their first or second or third trimester.
Yes, I think again for the women who are pregnant, as far as I know, they can be exempted and they can keep their fast once their pregnancy is over. But obviously, the ulama perhaps knows better in terms of what are the privileges
Guidelines.
available to them. Second is, if they are in early pregnancy, like first trimester, they can try to fast. The risk is low, but remember that in the first trimester, there is pregnancy-related sickness as well.
Sickness.
And if they are going through that, then the fast will break anyway. So again, they need to, it is again very individualized. Some women will have a lot of early morning sickness or sickness related to pregnancy, others may not. So it depends on how you feel. And when the pregnancy progresses in the second trimester or the third trimester, then the need for the babies increase significantly, and the women perhaps have to eat more regularly, and they will feel more hungry, and these long fasts may have their toll on them. And again, if you are concerned, you can certainly ask Ulama Ikram. I'm sure there is privileges available in our religion to keep the fast in other days when you're not pregnant.
What about sisters who are breastfeeding?
Yes, breastfeeding, if the baby is exclusively breastfed, there is possibility that the mothers might feel hungry, or they might get dehydrated, especially over the longer fasts. Again, those who can keep themselves hydrated between the iftar and sahur time, and some babies don't have as much demand, and especially those babies who are weaning at the same time, who are eating other foods, their milk intake is not as much as those who are exclusively breastfed. Then they can try to keep a fast, see how it goes for them. But if they feel that that resulted in the milk reduction, which would be reflected by the baby is still hungry, or baby is demanding milk again and again, and the women can tell that whether the baby has satisfied with the feed or not, and if it start affecting the lactation, then perhaps it is best not to fast.
Okay. Jazakallah. Continuing on the topic about sisters, some of the sisters are asking about there are now pills available to delay their periods. Now they're asking about Ramadan, and there's no requirement to delay your periods because you can make up your fasts later, right? But this scenario can happen during Hajj and Umrah. So somebody goes for Umrah or Hajj, they want to delay their period. So from a pharmacological point of view, how safe are these pills for someone to take?
So I think the most important understanding here is that the periods are the changes, hormonal changes in the body, which resulted in the start of the periods. These are the tablets which are a slightly higher dose of hormones than in the contraceptive pills. It is a similar hormone, but on a slightly higher dose. So what it does is it just changed that balance of hormones, which reduces near the time of the periods, and then once this balance of the hormone stays the same, the periods don't come. So these tablets I have prescribed, and many people, women has requested that, especially in those scenarios as you mentioned for the Umrah and Hajj. There are not long-term risks taking these tablets, especially if they are not taken that frequently. The important thing is that you can have the side effects of the hormones because it is a higher dose of hormone. And the side effects quite often are fluid retention, mood changes, breast tenderness. So these kind of things happen uh, as a side effects. Again, once you stop those tablets, the periods will come normally 2 to 3 days after stopping the tablets, and they can be heavier periods. So the women need to be aware of that. Using them for short period of time hasn't got much long-term consequences. It should not be used routinely, and it should not be used frequently.
Yeah, and there's actually, there's not a lot of need to use that during Ramadan to try to, get through your fasting or stuff like that. For Hajj and Umrah is a very peculiar situation. Okay. Jazakallah, what are your thoughts for smokers? Because obviously they're not smoking, between Sehri and Iftar. So can they do something about it to kick the habit in Ramadan? And what should they do?
So good question. It is never too late to quit smoking. As soon as you get a chance, you should do that. So first thing for us to understand is, what does quitting from an addiction require? I think it requires self-motivation, it requires discipline, and it requires a lot of encouragement. Ramadan actually is a time which provides you with this opportunity. You are very disciplined, you are very motivated, and the people around you are doing the same kind of things, which keep you going for a longer period of time. And you can always pray to Allah to give you the strength to continue with that motivation. So I think it is never too late, and Ramadan is a very good opportunity, because you perhaps will get a lot more peer support available during the periods of Ramadan.
So specifically, when you talked about some addiction and dealing with addiction, does this also apply for other things, substance abuse and stuff like that, other than cigarettes?
I think again, the substance abuse depends on the type of the substance and how powerful it is. Some smokers find it very hard to go without nicotine. Nicotine is not as powerful substance as any other opiates could be. So the more powerful a substance is, the more powerful addiction is, then the more powerful are going to be the withdrawal symptoms. So other addictions, if you try to detox without some help available to you, there is a very high chances that you would suffer really bad withdrawal symptoms. So I think best advice is that if there is any other substance misuse, then there is help available, and you should seek expert help, which will offer you community detox under controlled environment, where they will taper off the substance by replacing them with the prescribable substances in a tapering dose, so that withdrawal symptoms can be controlled. So I think for the other substances, you should seek expert help.
Okay. And when it comes to fasting during Ramadan, what are some of the other common illnesses within our communities that we should, the patients who have those should watch out for?
I think when the dehydration comes, there is a little possibility to develop water infections. That again goes with, especially with dehydration, the urine become concentrated. The concentrated urine then can cause problems by becoming infected. So be aware of that. The good thing is that in our community, the water infections are not very common. And one very important aspect of our religion as well is our hygiene. We look after that very well. Other things which can come, because it would, especially when the Ramadan will progress, eventually it will result in a slight reduction in your physical abilities. So your immunity can be slightly on the lower side. Normal coughs and colds can happen, and this is a very unique year because you can never tell whether it is COVID or not. So if you do develop any of those symptoms, which can be just common cold, still get the test done so that it could be differentiated from COVID-19. Some people will have, which is very common thing with fasting, people will develop indigestion. And it is just because of overeating and eating over a short period of time and then sleeping straight after eating. And these are all, this is perfect recipe to develop indigestion and acid reflux. So be very well aware of that. Acid reflux can also cause cough. And if you would have reflux and then you have the reflux cough and you come to the masjid in this year, everybody will perhaps look at you and will feel very uncomfortable.
Yeah.
So you need to be very careful. Again, simple measures, eating slowly and eating food uh, not in one go, which stomach can't handle. Have some at iftar time, have a little bit before Isha prayer, have a little bit after Tarawih prayer, and have a little bit at Sahur time, so that you can perhaps have the similar intake, but in short, smaller portions over a longer period of time or more frequently. Second is, there is a beautiful hadith that we should divide our stomach in three portions, one for food, one for water, one for air. Same is true for Ramadan. If you drink a lot of water because you feel you need to keep yourself hydrated and then you try to eat on top of it, our stomach will fill like a balloon and it will eventually start refluxing upwards, which will then cause indigestion symptoms, heartburn, and all that. So be very mindful of heartburns. If you do develop mild one, you can have over-the-counter remedies such as Ranis or Gaviscon type of syrups. But if it get to the state where it's keep on burning all day, speak with your doctor who can prescribe you some uh, medication to deal with indigestion. It is again one of the common ones. Other thing which can happen is constipation. Constipation can happen in people when they get dehydrated. It can also happen when your food habits change and you come across those foods which you normally don't eat. So keep an eye on it. Lots of over-the-counter remedies available. Speak with the pharmacist and they will be able to guide you.
Okay. One more question that's coming into my head. You remember last year, March 2020, when me and you were having meetings in the masjid about COVID-19 and things like that, and you were particularly concerned. The hospitals were filling up and so on. And many times you spoke and came and spoke in the masjid. What are your thoughts now, 1 year later? Are we coping better? I mean, what would you like to convey?
So I think two things have happened. Number one is that we have very quickly learned from this pandemic. It struck us from nowhere. It was out of blue. We were not as well prepared. Since then, the hospitals has expanded their capacity, especially the ITU capacity. But the good thing which we have already started seeing is that with this current lockdown, if you remember, first week of January, our daily infection rate was somewhere around 65,000.
Okay.
Thankfully, with this impact of the lockdown and the vaccination, the infection rate is as less as 5,000 or less in 24 hours. We have seen after quite a few weeks, the lowest number of deaths yesterday, which were, I think, 17 in England. The important factor to remember is that COVID is perhaps going to stay with us for a very long period of time. But COVID bothers us if it makes people so unwell that they need to get to the hospitals or admitted to the ITU, or God forbid, they pass away because of COVID. So I think these are the worrying bits of COVID pandemic. The idea was that once the vaccination will cover people aged over 80, our death rate should come down. And once the vaccination will cover the people aged over 50 and other vulnerables, our hospital admissions should come down. And this is the target which government wants to achieve by 15th of April. So I'm very hopeful that once we have covered our vulnerable population, our hospitals will have much more breathing space. We will have a lot less COVID-related admissions. We should be able to then go back towards more normal activities. And there is a lot for us to catch up. So I don't think that NHS will have any respite for next 2 to 3 years. However, that would not be COVID-related problems. That would be the long waiting lists and pending operations and postponed treatments, which we still have to catch up. So a lot of work for the NHS to do, and our part here is to not overwhelm it with a third wave, and hopefully we will keep it in the bay.
Yeah, one thing. Last week I was watching CNN, and there was a doctor from New York, and he talked about, because people have this misconception that there's a switch and we can switch on and we can go back to life what we had 18 months ago or something. He says what we're going to have to live with COVID and manage it. You mentioned this, right? So would you like to elaborate on that for people who have live under the misconception that life may go back to what it was in 2019, maybe?
So there is no switch on or switch off button. Definitely there would be gradual relaxation, and we still don't know many things. The one of them is how effective is the vaccination program and how long the effect will last. So remember that Spanish flu came in 1918, and 102, now 103 years later,
Yeah.
we still have flu every year, and it still result in mortality and morbidity, and we still are vaccinating against that flu. COVID is no different. It is a similar virus, and it is going to stay with us, and it is going to stay with us for a very long period of time. So what we perhaps would need to do is to have some sort of those measures which will reduce transmission. Uh, and if you remember, every year there is a flu campaign, and that there is a campaign which we call catch it and bin it, so that if you are sneezing or coughing, then either sneeze in your elbow or sneeze in a tissue and just bin it straight away. So these were the measures which were in place after 102 years of flu being around. So I can't see that the measures which we have for the COVID-19 will just disappear in June or July. I think they will continue in one way or the other, and we have to just make sure that we avoid its transmission as much as we can. But it is inevitable; it would happen. But if our immunity is better prepared, and if it is circulating among the people who can cope with it better without hospitalization and ITU admissions, then I think we will just get used to and will find a balance how to live with COVID over a longer period of time.
Okay. But when it comes to flu, I know the vaccines change because the strain of the virus changes. So are there any dangers of us, of the COVID virus mutating, and for us to modifying the vaccines in some way in the
You're
future?
already aware that COVID virus is mutating. There are strains, which is UK strain, Brazilian strain, South African strain, and this is quite normal for a virus to behave like that. I don't think COVID is behaving abnormally. It is just because it is so new and it has destroyed so much that everybody is worried about variants. But every virus mutates, and we know that. And what we do is we change the vaccine. The COVID vaccines are already looking into those mutations and already changing their vaccines accordingly. And that is why there are talks that there might be another jab required in winter, which can become more effective against these variants. But the important thing for us to understand is that these mutations does not change the whole virus. It only change part of it, but part of it remains the same. So the vaccination might reduce in their effectiveness, but it will still be far more effective as compared to those people who never had the vaccination. And therefore, my strong suggestion is that the people should have got the vaccines which are available now, so that they should have developed whatever protection they need at this moment of time. And don't worry about variants. Your vaccines will still be effective against those variants. However, if you need a booster for the better vaccines to deal with those variants, then have those boosters whenever they will come into the market. But please have vaccination. That is our only way out of COVID pandemic.
Two questions, and both are slightly controversial. Okay. The first question is, you were part of the discussions and me with different mosques and stuff about measures we needed to put in place last year, right? And the mosques dealt with them quite well. When we were going to the mosque, there were temperature checks and social distancing, prayer mats, etc. What I see now happening, as I've been to many mosques, people seem to be taking a relaxed attitude. Are you seeing that as well? And what are your comments on that?
Yes, I think I have mentioned that as well when we were talking about how the Tarawih Salah should go. Uh, I would say I would have two views on that. One is, being humans, it is our nature that we follow the rules up to a certain extent and then we just get bored out of them and we just like to break them every now and then. B, unfortunately, our communities are always a little bit behind when it comes to follow the rules. Uh, the bottom line is that what we don't want is that there is a third wave, which result in another lockdown, which then affect the opening of the mosques altogether. So there is a real risk, and I think my plea to our community is that please follow those guidelines because they are designed for your betterment and for your sake, and nobody else is going to get benefit out of that. So just follow them, and all the administration of these mosques, I would say, uh, please ensure that those guidance which the government has given you, the people adhere to it and take all necessary measures or steps to make sure that the people adhere to those guidance.
Okay. Last question, and this is kind of the people who have a conspirational mindset within our communities. Now, some of these conspiracy theories, we've had sessions with two virologists and so on, where we specifically addressed the technical issues of vaccination and things like that. Are you encountering these views in our community, and how does a common person deal with it?
I think it is a genuine problem, and it is not just confined to our community. It is in the news as well. It is a widespread issue. The people always have got a opposite view about vaccination or COVID-19, and you will see lots of claims coming through about COVID-19 itself as well as for the vaccination. Uh, I think the bottom line is for us to understand that this is this is a pandemic, and we have seen the effect of that pandemic for so long. If you go by the conspiracy theories, the world is equally affected by it. It has affected every religion, every race, and every country in the world. Some are worse affected than others. Only time will tell what was the reason behind that. Uh, we have seen that our population, the BAME community, which include our Southeast Asian population, are deemed to be at higher risk to develop severe COVID when they live in United Kingdom. So vaccination program has now covered over 25 million doses in United Kingdom. If there would be something wrong with the vaccine, 25 million is a very large number for any drug trials by any means. There would have been something coming out from either UK or Europe or USA, but nothing has materialized about those conspiracy theories. So my advice is stick with science, keep faith that if it hasn't hurt those many million people, it is not going to hurt us. And if anything, we will inshallah reap some benefits out of it, and it will bring our life towards as much normality as possible. So this is my message. Please do not hear to those things which are speculative. Just ask yourself, over 25 million people in UK had it. What happened to them? Answer will be nothing has happened to them. So just concentrate on what is the fact rather than what is speculation.
Yeah, lastly, someone sent me this, and I was not aware of this hadith before today. It is beautiful. It's authentic hadith. And what happened is Rasulullah sallallahu alaihi wasallam was passing by a leper. So, the Arabs used to consider leprosy contagious.
Yes.
And Rasulullah sallallahu alaihi wasallam, when he was passing by this leper, he covered his nose. Okay. So the people that were with Rasulullah sallallahu alaihi wasallam immediately responded, asked him, he said, Ya Rasulullah sallallahu alaihi wasallam, is contagion and not a thing? So Rasulullah sallallahu alaihi wasallam said, why not? So the commentators of hadith have said that Rasulullah sallallahu alaihi wasallam said, of course, so by contagion, the Arabs of before, they used to think the contagion happens by itself, right? No matter what, the disease spreads like wildfire. What Rasulullah sallallahu alaihi wasallam is trying to teach is that disease spreads by the will of Allah, of course. But here Rasulullah sallallahu alaihi wasallam himself is taking precaution, is covering his nose when he is coming in touch with a patient at his time who's a leper, right? Um, so I mean, this is absolutely beautiful that Rasulullah sallallahu alaihi wasallam is taking precautions when he's near someone who he believes to have a disease like that. And there are many different people talk about the history of Islam and saying, were any precautions ever taken with pandemic? Of course there were. Even the Sahaba, when they had contagious, they moved their cantonment, they increased distances, and so on and so forth. Have you come across anything like that in history, within Islamic history?
I think we know that there was pandemic at the time of Hazrat Umar Raziallahu Ta'ala Anhu, and a very prestigious Sahabi Rasul, Hazrat Abu Ubaidah bin Jarrah, was there inside that, in the middle of that pandemic. And Hazrat Umar Raziallahu Anhu asked them to come out of that area. But he said, no, the Rasulullah Sallallahu Alaihi Wasallam told us that if there is such pandemic, then the people should not go in or come out of that area to stop the spread. So it is no different than a lockdown which we are facing now. So I think the principles were set even 1400 years ago by Rasulullah Sallallahu Alaihi Wasallam, that how to deal with these issues, and and his companion has followed those principles. And I think we can go and learn from the history of Islam if we want to know how to deal with the pandemic.
So in your opinion, don't you think we should highlight these things, that even Rasulullah sallallahu alaihi wasallam and the companions took precautions when they were in the middle of these epidemics and pandemics?
Absolutely. I think it is, being Muslims, it is all of us, it is our duty that we should address this particular concern of our community from both angles, not only just from the medical sciences, but also from the religious angles, by giving them such examples and promoting that these kind of mayors are absolutely in line with Islamic education and training.
Okay. Jazakallah khairan, Dr. Saab. May Allah Ta'ala reward you for taking the time. Jazakallah.